Mhm.
So.
So you've seen it from both sides, and you certainly understand that first 6 months of your progression to where you could function in that role versus before where you couldn't. Um, Maybe some differences from your perspective. When should and when shouldn't a PT serve in this role?
Sure. I think, it's a great question because a couple things. I think I've actually talked to PTs that have said, I didn't go to PT school to be an independent practitioner. That has that just never really crossed their mind. But we need to change the culture just a little bit, because I think that folks that go to med school, they understand that they're going to be independent practitioners, and they take on that responsibility very willingly. And I think getting that culture change within the PT community is actually what we need. There's always going to be the opportunity to work, with a multidisciplinary team, and that you will actually take on responsibility yourself, but you also get actually input, from the rest of the team. I think that actually one of the things that they're sort of struggling with over in the UK is the liability issue, and they're working that piece out, because your liability will increase as you become actually more autonomous, which is okay, because I think we have the training to do that. So I think it's just getting actually used to that, and coming to the point that that's actually something that we can expect as a profession. I think that's where we need to go.
Mhm. So, talk about some of the pros and the cons. Certainly there's I can hear your tone with just how you remark in your comments that you're in favor of us functioning in that role. But are there any considerations where, okay, this is maybe a situation where there are some cons to the idea?
Yeah, no, I think not at all. And I would say that I think the physical therapist, the evaluations that we do, they're very, very complete. They should be. And so that we can actually begin to pick up on the patients that we need to refer off for either further workup or to like a different provider. Having the ability to actually order, imaging studies helps to clarify things often, particularly nasty things, tumors, fractures, cancers, those sorts of things. Two, I think that every PT has probably multiple stories of a patient that was referred to them from another primary care provider that the PT was able to pick up on the initial evaluation that this patient had actually something serious going on and they need to be worked up. And so I think we are very qualified in actually doing that. And I just think we need to have the opportunity to do that, and the opportunity to practice those skills, because those are the same exact skills that physicians, PAs, nurse practitioners, they practice every single day. And they miss patients. They miss actually some of the big things. Luckily, I think is that we actually catch a lot of those things, but I think it just makes you like a better clinician, knowing that that responsibility is yours, which it actually should be anyway, irregardless if you're seeing the patient through actually direct access. And so I think we're doing those things now. It's just sort of actually moving beyond that, we're working under this referral, which is not a bad thing, because I also think that that specialty clinics, they get referrals. So like neurosurgeons get a referral from a family practice provider. Oftentimes they need that referral to be able to see the patient for insurance and all those other things, but the patient actually comes to them and they're their patient. And so that's where I think we need to get, as opposed to, well, I'm actually sharing this patient, with the referral source, and anything that I want to do has to be ran through the referral source. It's the referral source. It's inefficient. It's wasting the education that we do have. And the patients are the ones in the end that actually end up having to pay the price, because oftentimes their care is delayed. The things that we need to do to get them actually better and actually get back to their lives oftentimes is delayed as well. So I think the system as a whole, I think it just continues to need to kind of evolve.
Hear the entire episode for free on iTunes, Spotify, other favorite podcast players, or go to mechanicalcareforum.com.